I went to Washington, D.C., up onto Capitol Hill with other patients and professional members of the Scleroderma Foundation to advocate on behalf of research. And one of the things we wanted to do but have not succeeded yet is to get the NIH budget significantly increased. Without an increase in the NIH budget, we're not going to be able to conduct the biomedical research that we need to conduct to find a cure for diseases like scleroderma. And we also run the risk of losing a whole generation of young investigators, men and women, who want to do research and who need to have support in terms of research funding in order to begin and establish their careers. So this is something that the foundation has high on their radar screen. Again, we didn't succeed this time, but we're continuing to work. Anytime you have an opportunity to see one of the state senators or your representative, get in their ear and tell them they need to support the NIH budget. The thing that we did succeed with was getting scleroderma added back onto the list of Department of Defense research priorities. So scleroderma had been on that list, and through a series of unfortunate events fell off the list this past year. And we were able to get scleroderma added back. And in addition, the budget for that program will increase from $200 million to $250 million this year. So investigators at MUSC and throughout the country will be submitting grants to the Department of Defense to see if, and to compete with other worthy research projects to see if we can get more research dollars to help continue our research. So that was a big success. Anytime you get a chance to see Senator Graham, please thank him for his support. In terms of NIH grants and funding, we have some good news. We think it's good news. I have a grant that got a very good score, and we'll hear in October from NIH, and we think this is going to get funded. This will be a 2-year research project to look at an existing drug, to repurpose it to see if it is useful in a disease like scleroderma. So, and then one of our other investigators, Dr. Torkin, is submitting another NIH grant. Again, as you may know, these are the most competitive times we've ever lived in terms of getting NIH funding. So to get a grant, probably only about 12 or 13% of all the grants are actually funded. So it's very competitive, and this is why we need more funding to support the research. There's a new initiative that did get funded. Those of you who came to the Education Day, the first year that we put it on, may remember Janet Poole, who is an occupational therapist at University of New Mexico. Janet got a grant recently, a $1.8 million grant, to develop and look at the feasibility of developing an internet-based patient support mechanism. So many patients don't have or don't live close to support groups, and so we'll be working with Janet. We'll be one of the 3 sites working on this project to develop an internet-based support system for scleroderma patients. Finally, at MUSC, we've been looking at scleroderma for, I would say, 40 years now. And probably the first 35 years were spent simply trying to understand the disease, which, as you know, is very complicated. And just in the past 3 years, we've now begun to develop what we hope will be new drugs for fibrosis. And we now, just within the rheumatology division at MUSC, have 3 new small molecules, each of which has been patented, and we hope eventually will be tested for safety and effectiveness in fibrosing disease like scleroderma. And it takes a long time to develop a drug, but the fact that we have 3 prospects is encouraging. And the one that's on the fastest track is a molecule that Dr. Fergali Bostwick has developed. Carol wishes she could be here, but she's in Boston for the Scleroderma Foundation board meeting. She's the director of the medical advisory board for the Scleroderma Foundation. But if you come in January to our program in Charleston, we'll definitely have Carol on the program, and she can bring you up to date on her drug. This has been licensed by a small biotech company, and they want to fast track it. So we hope that this will be developed quickly, that it'll be tested in normal people for safety, and soon thereafter tested in scleroderma patients for safety and efficacy. So you have to stay tuned for that, but we'll have more information to give you in January.